So we're starting to record. So your little questionnaire you filled in, so I'm just going to run through that. So you had no real formal training on weight-related communication?
Not that I can remember, no, which is strange, but no.
Okay, but training on communication skills in general?
Yes, I have. Yeah, I've had training on that throughout my career, if you like, and I've done some master's modules as well with advanced practice.
Yes,
so communication in that.
So you're an advanced nurse practitioner?
Yes.
Okay, and just tell me a little bit about the communication skills, just maybe not to do with weight, but what do you learn in your communication skills in general?
That basically to give people good eye contact, use of silences, to not talk down to them, to try and get eye level with them, so that you're not being overpowering to them, to get them to repeat back to you what they're saying, what you're saying rather, so that they can understand, and maybe even if you have the opportunity to go back to them after a while, see if they're still remembering what you've told them, because breaking bad news or whatever, it doesn't always sink in. Sometimes they take assumptions from what you've said, and sometimes it might be that you write a letter afterwards if it's been an outpatient appointment or something like that. You've broken news to them that's not that great. And also, it's good if you can find somewhere to talk to people that's quiet, that's not a busy ward environment, and if they've got any family or carers that want to come in and listen to, and that they're happy for them, encouraging that, because that helps with communication in the wider thing, if you like. Is that what you're kind of looking for?
Just interested to know the details. So whenever you filled it out, you also mentioned about sources that you go for information on this area. So you mentioned Weight Watchers, Slimming World, Dietitians at Work, and your kind of knowledge network. So just tell me a little bit about that.
So basically, because as I said, I can't actually remember being given specific education on talking to anybody about weight loss as a professional. My experience in weight loss has been mostly through my own personal experience. Although, of course, we've had patients that were encouraging to lose weight. But for instance, the last 10 years of my career has been in medicine of the elderly. So weight is not necessarily, or weight loss strategies is not necessarily one of the big priorities when I'm seeing the patients. So that's why weight loss, Slimming World, and that's sort of in there rather than anything else. I do have previously covered wards that give people treatment for obesity and weight loss surgery and whatever. So I'm aware that there's dietitians within my organisation that specialise in patients that are obese. So I have used them in the past if I've got questions about specifics with weight loss. I'll go and find that individual rather than just asking a wider group. And the knowledge network, that's just if I'm looking for some academic papers or whatever. Knowledge network lets me into, it's got the Athens password and stuff like that, and so you get into all the different search engines to find something there.
So that's your professional kind of academic knowledge based in Scotland. Okay.
Yeah.
And the Weight Watchers and Slimming World, would those topics ever come up with patients? Obviously, maybe not in the last 10 years if you're working with older people.
No, I can't actually ever remember suggesting to any of my patients that they join Slimming World or anything like that. But I've spoken about it with my colleagues. You have the conversations about diets. I've always had problems with my weight, and there's lots of other colleagues that are always on a diet of one sort or another, and they're the two ones that I've ever really had anything to do with, that have gone to any classes or whatever. So that's
okay. That's good. And then in the future training needs, so you've ticked the boxes around the communication skills theory and the hands-on practice and the science of weight and obesity. So, I mean, if you were looking for an ideal training tool in this area, what do you think would help?
It would be nice to find a forum. I've not looked, so there might well be one, but a forum of like-minded people, if you like, or professionals that are wanting to approach this subject with patients and whatever, so that you get some peer support and also some experienced people speaking to you rather than I've heard this and I think that and whatever that might not exactly be scientifically or research based, so that you feel like you've got a forum that you can speak in where people are listening to you, are going to give you appropriate advice rather than weirdest I've heard of, eat a banana a day, you'll lose tons of weight. So I think that would be good. And also if there was something that we could recommend to patients that easy and perhaps NHS backed to help them lose weight, because things like Weight Watchers or Slimming World or whatever doesn't have a big NHS banner on it. And I know that you can go online, there is NHS advice on weight loss. So if I was cornered tomorrow by a relative or whatever, I would suggest to go on the NHS website and have a look at what they suggest there. So there is some information that I'm aware of that's out there on weight loss. So it's maybe just been my lack of experience in the area rather than there not being the tools out there that I think I would need to advise someone.
Okay. What about, demonstrations or even hands-on practice in this area? Would that help? Watching other people demonstrate it?
Yeah, I think that always does help, because if you see somebody do something well, you want to be like them and you want to deliver it like them. And if you see successes that they're doing, that's helpful. It's quite good to see people doing things not so well as well and think, oh, I'm definitely not going to do it that way. So yeah, I always think it's quite good to learn that way too.
Okay. And then the last wee thing about your training questionnaire. So you'd mentioned about, I guess, the environment that you're working in, healthy options, a canteen, maybe something in the community to refer people to, and exercises classes and so on. But tell me a little bit about that.
I think it would be good, for instance, in the hospital I'm working, I've changed my office recently and I now have an office within the physio department. And I see that they've got probably about 3 gyms that look like gyms with weight machines and stuff like that often sit empty without people on them. And I think that's a huge loss of opportunity, in that there's staff that would perhaps go down and use those machines if they were given slots during the day of, you could go down there for an hour first thing in the morning, last thing at night. And, I just think it's a shame to have that on site and just not use it. So that kind of irks me a wee bit. Our canteen does have healthy options. It has baked potatoes and stuff like that for lunch. But then the stuff to put in your baked potato tends to be coleslaw with lots of mayonnaise on it, or cheddar cheese, or tuna mayonnaise. They're not exactly healthiest options, and they're not touting a healthy kind of lifestyle, I think, through the canteen, although they claim that they are, but I don't think it's working terribly well. And we do have a Marks and Spencer's on site, which is quite good. So you can perhaps go and buy some healthy stuff from there, or if patients want to go and find it, they can find it, but it's not the cheapest way. So I think the NHS certainly, or the hospital I'm in, is not really using everything that they've got to hand to maybe encourage us to be slimmer or healthier. And I think that they do encourage us. There's something with it being called the Royal Infirmary, we have the Royal Mile, so walking around the campus area. But then you get into all sorts of problems in that you're not supposed to be outside in your uniform. So there's a short part of the walk that kind of goes on the main road, so you're supposed to change and then go, and it's all a bit silly. But at least they're trying, and they try and encourage people to cycle to work. So there are NHS things to encourage staff to cycle, with being able to buy your bikes with money off and stuff like that. So they are doing a bit, but it's not always so obvious what they're doing. Because of course, if the staff were fit and healthy, and I know myself, being a fat bird, that when people have spoken to me about losing weight, if they're sitting there all slim and skinny and going, oh yeah, I know losing weight is difficult, and you think, really, is it? It would just help, a wee bit if they'd be able to say, well, I've lost weight, or I'm doing this, or whatever. It's just that I think would help with the communication about why it's good, because you can see an example of how it works.
Okay.
If that makes sense.
Yes, no, perfect sense. And the gym at work, who was that for? Was that for staff, or was it just a general gym?
No, it's a general gym. Our physio department outpatient has, when people have come in for physios for strengths and for their lower,
The rehab?
whatever, for rehab type thing. We're not really a rehab hospital, but we have these facilities. And I think when we initially set up, the idea was that these gyms would be much busier. And I don't police them. I don't wander past them every day, every hour of the day. But certainly first thing in the morning, when I go to fill my kettle, it's empty. And last thing at night, when I go to do my dishes, it's empty. You know, and I just think, what a waste.
Okay, so that's all the training bit. So just want to move on to opportunities to talk to patients about weight. So I hear what you say, maybe in the last kind of little bit of your career, this is not so relevant, but maybe just think back over your career. So, I mean, how would you approach that conversation? How do you kind of raise the topic?
Well, I suppose it depends what the patients come in with. If they've come in with something that's affected by the fact that they're more overweight, that's an easy in, if you like, by saying to them, you know, you've got heart disease, you know, you're a bit overweight. Maybe it would be helpful if you could try and lose some of that weight, and that would take some of the pressure off your body. So that's one approach. I know that obesity is so linked to many cancers these days. I think that would be a more difficult conversation to have with somebody, saying there's a likelihood that you'll get cancer if you don't lose weight, because you don't want to go around scaremongering people into doing it. But you can talk them round and say, it's, you know, if you're slimmer, there's less likelihood that you might get cancers because it's more associated with being on the heavy side. So it's almost easier as a nurse in a hospital to talk to somebody about their weight than it would be, I suppose, in a GP practice, because when they're in the hospital, they're in there because they're not feeling great in themselves or they're not well. So they're maybe more willing to listen to you than sitting fit in what they claim to be healthy in an outpatient setting, thinking, well, I've not had problems with my health, so why should I listen to you? And as I said as well, being a fat person as well, you've got to be careful how you approach it, because I might be suggesting to someone to lose weight who's slimmer than me, and you know, you've got to get the correct rapport, because you know they'll be thinking, well, I'm a lot lighter than you, so what are you trying to push? So sometimes I feel a bit guilty, and I might avoid having the conversation because I think, let's wait till one of my slimmer colleagues comes on and get them to do the talk.
So how would you get that correct rapport? What works for you?
Well, you'd have to build a relationship. It's be good if you were looking after the patient for longer than just 10 or 15 minutes, sort of an appointment. So if they're one of your patients in the wards, then it might be easier to build up that rapport on a daily basis. These days, we don't get to keep patients in hospital terribly long, so you'd have to be a bit savvy about how long you waited to have the conversation. You have to observe people as well as to what they might be open to, because some people like the upfront, straight talking, this is what you need to do, and other people you have to take a more softer approach, because they really, if you take the hard approach, that they close right down on you and they're not going to listen to anything that you're saying. So you'd only kind of get to know how they take things by maybe watching and observing them with your colleagues, with their visitors, with other patients, and sometimes we don't always have time to do that.
So on that vein then is, you know, what would you be able to pick up from a patient that would kind of show you that it's okay to raise the topic?
Well, it might be that they raise it themselves, because there's always the, you know, oh, well, I've always been overweight and whatever, or, you know, I wish I wasn't so big, and you can start chatting to them about that sort of thing then. It might be that if they're being discharged and you're giving them their discharge drugs and going over the stuff in their discharge letter, that you get the opportunity then, because then they're willing to listen to you, because there's a carrot on a stick, if you like. They're going to get to go once they've finished listening to you, so they might be a bit more open to listening to what's going on. I don't think that it would ever be good to speak to somebody about their weight immediately after they've been told some really bad news by a consultant, to whip on in there with, let's look on the positive side, let's see what we can do, let's lose weight. So you have to kind of gauge your audience, if you like, or your patients as to their mood, and also your own mood. If you've got 600 things to do and you think, right, I'll just do this really quickly, and you don't appear to be particularly interested in what you're saying, your patient's not going to be interested. Even if it's just you're not interested because you're thinking, right, I need to do this, and then I need to do the next thing, the next thing, the next thing. So you have to show them that you've got time and you're interested in what they're saying as well as what your subject is.
So there's a sense of kind of picking your moment, understanding your patient where they're at, and making sure that you're in the right kind of headspace to do it.
Yeah. And that you've got the correct information to hand, because it's nothing worse than if you actually manage to broach the subject that's a difficult one. They ask you a question and you think, oh, right, okay, I haven't got that with me. I better go and get whatever it is that I need, because by the time you come back, they might have changed their mind. So not to go in half-cocked, as it were.
And what sort of information do you think is useful? What sort of questions patients ask?
Just to be familiar with why I'm going to have the conversation with the patient in the first place, in case they ask me about the wider aspects of their health, as it were, if I'm having the conversation with them because they've got heart disease or because they've got cancer or whatever, so that I wouldn't kind of say, oh, let's not talk about that just now, because it's what's important. The patient, you have to keep them on subject, but you can't just brush something under the carpet because you don't want to talk about it. So to have enough knowledge on that background thing, to even just say to them, well, I don't know about that, but this is where you could get more information on this, that, or the next thing.
Okay. So there's a sense when you bring the subject up that you've already thought through it and you kind of have a goal in mind for bringing it up. Okay.
Yeah.
And then, generally, so if patients aren't bringing it up and you bring it up, what's the sort of reaction typically you get from patients?
Well, for the most part, people will say, oh, yeah, no, I'm a bit overweight, or yes, well, aren't we all, or something like that. And you can tell by the reaction whether they're going to be in to you going a bit further forward with that conversation, or whether they just kind of dismiss it, change the conversation, or just don't reply to you at all. Unless you've said, I need to come down and talk to you about something specifically, so that they're ready and waiting for you to come up with something. I've never had anybody be rude or aggressive to me if I've spoken to them about their weight, but it's not really been, I've had much more experience in conversations with other subjects than weight loss. So I'm maybe not the most experienced to talk about weight loss, if you know what I mean.
Yes. And then that the language in this area kind of changes all the time in terms of the words that we use to describe being overweight or even living with obesity. So what sort of language and words would you use?
I'd maybe say a bit heavier than healthy for you, or you might be able to lose a few pounds to help with such and such. I think it is really difficult because you have kind of hit it on the nail there. There's so much talk. One day it's all right to have a glass of red wine, the next day it's not all right to have a glass of red wine. And I think the public these days are, I'm going to say, they're better informed than they've been in the past 30, 40 years, because now they've all got the internet and Google and all this sort of thing. But when I say better informed, they might have all the sort of nonsense information as well as the real information. So it's difficult to try and hit on the right thing. And just what I suppose I'd say is that, this is what we're feeling should be right for you now. And, it's not, we're not trying to we're not trying to turn you into a skinny mini, but we just feel that, maybe a stone or so might be helpful, just a small, because it's like anything. If you start with small bites and it works, you might carry on. And I've just used an analogy meaning food there as well, having a small bites. That says more about me than anything else. But, you know, small goals, that might encourage them to lose a bit more or at least feel a difference. And I'd also say to them, you know, you might feel better in yourself, especially if they've been in hospital not feeling great. A bit of weight loss, a bit feeling healthier and fitter, just might help them with the rest of their life aspects.
Okay, so moving on then to specific examples, if you can kind of maybe remember. So if you can recall a conversation around weight that you've had with a patient, and just talk me through it. You know, how did you raise the subject? What did you say? How did the patient react? If you can.
I remember a conversation with a girl who was very obese. She must have been over 20 stone, and she was young. She also had some, I'm not sure, she wasn't tagged officially with learning difficulties, but she wasn't, bless her, she wasn't very, I can't think of the right term to use. I want to say she wasn't the brightest person. So she felt that her mother had looked after her since she was born. She'd never moved away from home. Her mother used to feed her constantly because every time she had health issues, so her mother would reward her with food. And I remember it was a horrible conversation because the two ladies on either side of her in our Nightingale ward had been rude to her about her weight, which really was not fair. But it's just the gown didn't fit properly at the back, so she got up to walk round her bed, and I was really surprised at those two ladies. So it was difficult, and she'd tried diets before and they hadn't worked, and she just needed a lot of help, more help than I could offer. So it wasn't just, although I was the one that picked up on this conversation, it wasn't just about what I could give her. Of course, the whole ward was, our team were trying to encourage her to lose weight. We'd got the specialist dietitian involved. But I think that sticks in my mind because it was just other people's reaction to this girl who didn't mean to offend people by her size, but the two women on the either side who didn't appear to be rude or nasty or whatever, they just hadn't thought about what they'd said to each other. They spoke over her bed about, you know, that's ridiculous. So that's the one that sticks in my mind most about talking to someone at work about their weight, a patient.
And how did you handle that situation? I mean, what would you have said to the patient?
Well, we went to the day room and sat there for a while, and we talked a bit about her eating and everything like that. And it was much deeper than could be done in a half-hour conversation or whatever. And she did kind of know, but the following day, for instance, she already had cakes in her locker that her mum had snuck in for her, and she offered me a cake. And as I say, she wasn't officially tagged learning difficulties, but I think she just didn't understand that the food was making her, wasn't her friend. She was just a prime example of comfort eating that was just difficult to get past because of all her issues. Okay. So we spoke for half an hour, and then afterwards the dietitian went back to see her, and I mean, she was discharged. Unfortunately, she did die a couple of years later of obesity-related illnesses. She had heart problems and stuff like that, and she never did lose the weight. And I just felt heart sorry for that girl. And sometimes when I'm feeling fat and unhappy with myself, I think, oh no, I'm going to end up like her. But anyway, sorry, I've gone off subject.
No. It's good to hear that stuff. I mean, on reflection now, I mean, obviously that's a very, very difficult situation. On reflection now, do you think anything could have been done differently? I mean, not just yourself, but just in terms of other support and stuff.
I don't know. In her case, it was such a huge. It would have been a change in society, because it went back to her mother protecting her and thinking that food was the answer for everything. If Linda was happy and well fed, then she should be healthy and everything should be great. And so maybe going back to the schools and putting in education right in the schools, which we try to do now. Children do know that they shouldn't be eating lots of sugary sweets, and they do know that you should be out and about running around rather than on your laptop all the time. So maybe things have changed. That conversation that I had with that patient was a good 15 years ago, and at that point she was in her late 20s, so probably going back 30 to 40 years when she was a child. There was not quite the same sort of structure in society to support someone with, you've got a child, you shouldn't be giving them lots of big heavy meals and look at her weight, and maybe support from the mother from when she was younger and growing up, as opposed to just giving it to Linda within the last few years of her life, when the NHS perhaps went, you've got all these health issues, we think it's all down to your weight, can we see what we can do about it? It wasn't too late by then, but it was perhaps too late for certain aspects of her behaviour towards food. Am I making sense? Sorry.
Yes, you are. No, I mean, there's a sense that, you know, that your communication with patients, it can't happen in isolation. There's lots of stuff going on around that needs support as well,
Yeah.
families and so on. You know, so that makes sense to me. So if we could think about a conversation that you think has gone well, and that you've actually helped to improve a patient's kind of quality of life or health, and talk me through that. Sure, you've done this in loads of different cases, but I'm thinking specifically around weight.
Right, okay, I'm trying to think. I mean, I changed posts about 6 months ago, and I suppose I have spoken to one woman in particular, who came in with, it was asthma that she came in with, but part of her asthmatic issues she felt was down to the fact that she was so uncomfortable about her weight. So we did have a conversation about how difficult it was to lose weight, and how you have to be in the right mindset, and sometimes that's nothing to do with what's going on round about. If your mind's not set into, right, that's it, I'm getting on with it, then people can give you all sorts of help and support, but you just get really angry about it or upset, or you just don't listen to them. So she did leave saying, I'm going to give this a go, but she's never been back. I don't know whether she's losing weight or not. I think she did mention Weight Watchers at the time. I didn't mention it, but she did say that she didn't find it easy to lose weight in a class. She found it better to do it by herself. And, you know, just kind of pointing her into the direction of, you know, well, there is help online. These days, everybody's online, and you know, they can look at menus or be part of a wider community. That doesn't necessarily mean they have to go to a class, but they can get suggestions of healthy food or healthy eating, or just ask daft lassie questions, you know, in a forum that's not necessarily was available 20 years ago. And it can be very embarrassing for some people to go to a class to lose weight. And there is sometimes a thought that people are fat, are thick, because they don't realise that by being so fat that they're putting themselves at risk of all sorts of things. Whereas if they were more intelligent, they'd be slim. Because sometimes I've moved into me now, but sometimes as a fat person, you sometimes think that people kind of go over you, but that's stupid. Anyway, sorry, I've gone off subject again.
That's all useful. So I'm just thinking that when you talk to that patient with the kind of asthma risk, so obviously you made it easier for her to talk about that. And I mean, her sorts of questions, would she have been asking you about, you know, how do I lose weight, or what's the best way to do it? Is that the sort of thing she'd be talking to you about, or?
Well, she'd said that it was difficult to lose weight, but she hadn't found a way that worked particularly well for her. So we did talk about the different ways. That's why we talked about Weight Watchers and online and stuff like that. So she was aware of these different bits. She felt that maybe if her family were more supportive, that would be better for her. So she was going to see if she could get her husband to go on a diet with her when she left. So I don't know. I don't know that I actually gave her any more. I suppose I would just listen to what she was saying rather than giving her anything extra. I'm afraid I wasn't able to whip out anything out of my pocket with, try this or that.
You give her the space to think through it.
Yeah.
So we know that weight loss does improve health, but even eating a little bit healthier or eating more vegetables kind of improves health as well. So would you ever have those conversations so even though if someone is overweight, there are things they can do to improve their health that doesn't just involve weight loss? I mean, do you have those?
Yeah, there's portion control, which, is quite important, because sometimes people just get ridiculously sized portions. There's these plates you can get from, I think it's even Matalan that has some that's got meat or protein and vegetable and whatever, to give people ideas of how much they should have in each food source as it is in their plate. So I suppose that I could have said something to her about that, to think about that, so that when she's dishing food out, if she had her plate with how much portion she's supposed to be having, that it would make more sense and make it easier for her, rather than thinking, have I taken myself too much there or too little? And of course, there's all these, instead of having a big huge plate of potatoes these days, people are maybe using turnip or something that's maybe thought not to be so calorific. There's instead of rice, cauliflower rice, or thinking of different options to use that in the supermarkets are now much more readily available than ever before if you go looking for them, or these weird noodles. I can't remember what they're called, but they're supposed to be very low in calories.
Okay. Do you ever get frustrated with patients when you're thinking about either talking to them about weight or when you're talking to them about weight?
No, I can't really say that. I do get frustrated with them because, well, it would be a little bit. I get frustrated with myself about weight, so it's not fair to get frustrated with the patients about weight when it's something that I haven't managed to do. And because we have them for such a short period of time, then I suppose I don't see weight as something that I would necessarily keep pushing forward with them to consider. Which, until I was put myself up for this bit of research, it's really weird how little I've really engaged with weight loss conversations or this kind of thing with my patients. Done all sorts of other conversations, but weight loss or obesity has never really been high on my agenda. But strange.
Busy job, I bet. I bet it's a busy job. So, you mentioned a little bit there about what I would call weight stigma. People making assumptions because of your higher weight. So, do you think weight stigma has an impact on how you communicate? Maybe not you personally, but in general, does it impact the communication with patients? The notion of weight stigma.
I think it does, but I don't have any examples stuck in my head at the moment. I suppose that just what I said earlier, that sometimes people seem to think that fat people aren't particularly intelligent. Not everybody, and that's a sweeping statement, but I have seen examples either with myself or my friends where people have talked down to them, and I think there's no need to do that. They're actually much more intelligent than you, and that might not be anything to do with them being fat. That might just be the other person's not a very nice person. Don't know.
I mean, have you ever witnessed weight stigma in colleagues with patients or in your
Yeah, you do get the occasional colleague who will make derogatory statements about, oh, well, what's the point? Look at her, she's never going to take on any advice because she's still smoking or she's still drinking or she's big. So why are we putting all this effort in, And of course, there's some people that make flippant comments about, you know, like, well, if they won't help themselves, why will we help? And there's also that, I'm sure so on the television, there's a couple of NHS health boards that are really reluctant to do weight loss interventions with their patients because they don't see that as a priority. They see, you know, so it does make it all quite difficult ethical conversation on a wider level, if you like, as to what kind of approaches we're using. There is weight loss surgery done within my hospital that I'm aware of, and the consultant that does it, he's maybe not the most it's not got the best bedside manner, I think is the best way to put it. So even though it seems to be his area of expertise in the theatre, he's not maybe the best person to have the conversations about weight loss. But again, I've not worked with him for years. I just remember him from previously when he's broken hard news to people and it's not been done really well. So I can't imagine that he's doing it well with weight loss. But anyway.
Well, listen, that finishes me in terms of all my questions. Is there anything else you would like to add, Anne, or anything you think might be useful?
So yeah, what's your question? Your research question. I mean, what are you?
So my research question is, will training on sensitive communication skills around weight improve how we support patients? So I'm coming from a communication side, and what I'm hoping to do is develop a training tool so healthcare professionals can actually practice having these conversations.
Absolutely, yeah.
And then even try it out with each other and reflect and so on. So you guys seem to get a lot of training on different types of communication skills, but nothing specifically around weight. And what you said today is very correct in that there is so much information out there, you know, and people are bombarded with stuff. So what I'm trying to do is focus it into like a set of not a conversation script, but some useful advice about how to raise the topic and language to use and how to frame it with the patient that they're more receptive to having this conversation in a sympathetic and compassionate way. So that's kind of, does that make sense?
Yeah, absolutely. And as I said, I'm really surprised myself by how little I've had to do with weight loss communications in 35 years of nursing. It's just ridiculous that I've never really thought about it. And we're very good at handing out leaflets to patients, chest pain, asthma, all the sort of things. But I don't even think we've got a weight loss leaflet to hand out to people, which would actually be quite helpful to have, even to start at that basic level of communication. So yeah, I'd be interested to see the outcome of your research, Fiona.
Yes. Well, sure. Listen, I'll let you know. I'm only coming to the end of my first year, so I've still got a fair bit to do. But yes. But how did you hear about this? Was it through Tricia?
Yes. I think she put something on Facebook.
Yes. Yeah. I interviewed her, and then she said she would pass it on to some colleagues. So. Okay, well, listen, I'll finish up there, and thank you very much. As I say, at any point, if you decide you don't want me to use your info or your kind of responses, you let me know. But I'm really appreciative of your time. I know how busy things are for the likes of yourselves. So, and thank you for all your honest answers as well. So that's really helpful.
All right, no, thank you.
Enjoy the rest of your day. Bye bye.
Thank you. Bye.